Well, new CDC findings show a trend that may be making us sicker as a society. Fewer kindergartners are receiving routine childhood vaccinations, while exemptions are on the rise. And this decline comes during a year when measles cases are killing kids. Health reporter Haley Hernandez has more on back-to-school vaccines and why they're so important.
Yeah, good morning. So every year, kindergartners and seventh graders are required to provide immunization records to schools, and the only way around that requirement is to get an exemption through the state. The American Academy of Family Physicians is now urging parents to protect your children as they head back to school.
Kindergartners, by now your 5-year-old should be able to show proof of DTaP, polio, pneumococcal, hepatitis A and B, and the measles, mumps, rubella vaccine.
MMR is given twice.
For seventh graders, the list is shorter but still important. Tdap and meningitis get added. But here's the worrying part. The number of parents saying no to vaccines is going up. The rate of vaccine exemptions for Texas students has been dramatically rising. The highest rate of students declining vaccines is in Galveston, where 1% opted out in 2015 and now nearly 4% don't get the recommended vaccines. In Harris County, during the same time, exemptions rose from 0.6% to more than 2% now opting out of vaccines. That's triple the request for exemptions. I sat down with Dr. Dwayne Broussard, president of the Harris County Medical Society, to discuss this trend.
Is there anything that you see alarming about that over a 10-year period, jumping about 2% in exemptions?
That is alarming, with measles cases on the rise and children being hospitalized. And unfortunately, we had 2 children that actually passed away.
Even though measles vaccination rates are still high in our area, they're falling fast. Take a look at the current rates for Harris, Galveston, Fort Bend, Montgomery, Liberty, Waller, and Brazoria. But take a look at where we were in 2020. You see vaccination rates fell in every county and has the greatest decline in Harris County at almost a 6% dip.
And the World Health Organization considers 95% vaccination to be herd immunity. So, I mean, is it safe to say that we don't have herd immunity towards measles anymore?
In some counties, that's definitely true.
Does that concern you?
Yes, some people are very vaccine phobic, if you will, and that's just requires a discussion with the physician. The risk of having hospitalized and the risk of death goes way down if you've been vaccinated. So it's kind of like wearing a seatbelt. You know, the seatbelt really didn't, prevent the accident from happening, the car accident from happening, but it did prevent you from going through the windshield, so to speak. So we know that there are true benefits to being vaccinated.
So if your child still needs to get updated on immunizations before you start school, or if you're really unsure what they've had, you can go to any clinic giving back-to-school vaccines. I know of one happening today at the Tracy Gee Community Center. They are going to be located in room C today. Vaccines are available at no cost, but they are a first-come, first-served basis. And if you miss out on today's, you can go to the Sheldon Health Hub on Saturday. They are also having a back-to-school event where vaccines will be offered, and that one is from 10 a.m. to 2 p.m. on Saturday. They ask you to please bring your child's shot record. Some of the other things being offered are sports physicals and dental screenings. And as always, if you have a pediatrician, you can always contact them. They can be sure to help and let you know what your child may need to get up to date on before the school year starts.
Yep, we get reminders all the time.
Yeah, there's lots of health clinics happening right now specifically to get kids ready for back to school.
It's that time of year.
Yep.
All right, Haley, thank you so much.